Debate, reprise de débat. The Honourable Member for North Island, Powell River.
Thank you, Mr. Speaker. Today, this House stands to discuss Bill C-14. As we do so, we must seriously consider this important responsibility. The Supreme Court decision has been made. The job in this House is to create legislation that will provide clear boundaries moving forward. In February 2015, the Supreme Court of Canada concluded that the absolute prohibition on assisted suicide violated the charter rights of Canadians suffering intolerably with grievous and irremediable medical conditions who, being adults and assessed as competent decision-makers, would otherwise seek medical assistance in dying on their own terms. In response, the Joint Special Committee of Parliament was tasked to consult with experts and Canadians who reflect the diverse perspectives on this issue. They reviewed the Supreme Court's decision in Carter and the 400-page judgment in the BC Supreme Court that preceded it. It studied Quebec's new assisted dying law as well as the reports of two major panels on medical aid in dying, which together heard from 13,000 Canadians and over 100 organizations. The committee then held 11 hearings, called 61 expert witnesses, and received more than 100 written briefs from groups across Canada. I have read the report and want to thank the committee for the great work it has done, resulting in 21 recommendations on a legislative response. These recommendations demonstrate balance and sensitivity, respecting the autonomy of patients, the rights of healthcare practitioners and vulnerable individuals, and the fundamentally personal nature of this issue to every Canadian. I've also been listening to the members in my riding of North Island Powell River, where people are very concerned. Many from my riding are worried that there is not enough support for palliative and end-of-life care. They want to know the vulnerable will be protected, and they want to know that those who suffer greatly can decide to die with dignity. I have had many letters from my constituents and know there will be many more. This is a subject that deserves much discussion in each riding across Canada. Bill C-14 is also a very personal one for me. Years ago, I was a volunteer for hospice and watched many people die. I remember being present for people who were in so much pain and who wanted the release of death so badly that starving themselves became their only solution. I remember the agony of the person and their family who just wanted a safe release from this pain. I also sat with people who fought every day for one more. Their desire to continue in the face of such pain was tremendous. After volunteering there for years, I left knowing that death is an intensely personal process, and honoring people and their families through it is so important. Today, I am wanting to talk on Bill C-14, the Liberal government's legislative response to the Carter case. The Liberal bill has raised new concerns and leaves many questions for me unanswered. There is consensus among academics, health professionals, faith communities, and the public that Canadians deserve better end-of-life and palliative care treatment. The federal government has a role to play in working with the provinces, territories, as well as First Nations, Inuit, and Métis communities on finding strategies that work. We have a critically important opportunity to enhance services across the country, yet the government was missing in action in the budget on palliative care, even after promising $3 million for home care during the campaign. Holding the government to account on this promise of what the motion remains one of our top priorities as we assist in the legislative response to the Carter decision. This bill refers to palliative care in its preamble, yet while introducing this bill, the government made no new commitments to palliative care. Mr. Speaker, the people of my riding want to see this investment happen. The NDP took a significant step forward in the last Parliament when a motion brought by the member for Timmins James Bay to establish a pan-Canadian palliative and end-of-life care strategy, which earned nearly unanimous support of the House of Commons. Palliative care is about patient and family-centered physical, psychological, and spiritual care. Everyone dies. Every family has to deal with the loss of a loved one, and these traumatic moments are made more difficult and more expensive when there is no access to quality palliative care. With an aging population, it is crucial that the federal government provide leadership now. Mr. Speaker, the government backgrounder refers to the following system to ensure equal access. quote, "The government is proposing to work with provinces and territories on the development of mechanism to coordinate end-of-life care for patients who want access to medically assisted assistance in dying. This system would help connect patients with a physician or nurse practitioner willing to provide medical assistance in dying and support the personal convictions of healthcare providers who choose not to participate. It would also respect the privacy of those who are willing to provide this assistance. This system could also offer other end-of-life care options to both patients and providers," end quote. However, this is not mentioned at all in the bill. This leaves a lack of clarity and room for poor decisions. It is important to respect both the healthcare practitioner's freedom of conscience while at the same time respecting the needs of the patient. Having seen the previous government's agenda being held up in the courts time and time again, Canadians expect a government to be thorough. Now is the time to strengthen the bill against charter challenges by resolving contradictions with the Supreme Court ruling in Carter. Canadians have waited long enough. Let's get it right the first time. It's not a partisan criticism either. Senator Co-Chair Conservative Ogilvie told the Hill Times the law as it's been introduced will be challenged in courts, and he is disappointed the government didn't take more of the committee's recommendation. This is not a case where good enough legislation is good enough. This is a life and death issue, so let's get the right legislation. The people in my riding are concerned about safeguards. They know the value of life and want to make sure that some lives are not considered less valued than others. I cannot agree more. I have members of my family who have severe mental illness and who are differently abled. They are precious to me, and I would not wish them gone from my life. Right now, Bill C-14 would legalize medical assistance in dying for competent adults 18 years of age or older, meeting the following criteria: serious and incurable illness, disease, or disability, in an advanced state of irreversible decline in capacity, experiencing enduring physical or psychological suffering that is intolerable to them and cannot be relieved under conditions they consider acceptable. Their natural death has become reasonably foreseeable, taking into account all of their medical circumstances without a prognosis necessarily having been made as to the specific length of time that they have remaining. There are also requirements for 2 independent medical practitioners or nurse practitioners to confirm the criteria. The request must be in writing, where possible, and witnessed by an independent adult, and a 15-day reflection period must be observed. To help protect people in vulnerable situations, the witnesses to request cannot be a beneficiary under the will of the patient, someone who may benefit from their death, or directly involved in providing care to them. The 2 physicians or nurse practitioners must also be independent from one another. Safeguards must be there to provide the support that patients and their families need during this painful time. We know that this is a difficult issue that touches many in a personal way. There are many issues to discuss, and we hope to see them discussed. So I will be voting in support of this. But I know that this is going to a special committee, and when it returns to this House, I hope to see so many more changes made. Many speakers today are expressing their profound disbelief that Kay Carter, one of the 2 women on whose behalf this case was brought to the Supreme Court, that Bill C-14 would deny her, suffering from serious and incurable but non-fatal conditions, the right to choose medical assistance in dying. According to many experts, their only remaining recourse to meet the bill's final criteria would be to starve themselves to near death, as we have seen people do in Quebec, in order to meet the province's eligibility criteria. I have seen this in action, and it is a dreadful way to die. Going forward, New Democrats will consult with experts and people affected as we study this legislation very carefully. As Amy Engel wrote, "I want to be someone strong and brave enough to make hard choices, but I want to be fair and loving enough to make the right ones." Thank you.